Hello, I'll be talking about fibromyalgia. Primary fibromyalgia syndrome, the etiology of the condition isn't entirely pinned down. They know that it involves abnormalities to the neuroendocrine and autonomic nervous system, and it has some genetic and environmental factors, but they don't know exactly where it comes from. Demographics. It predominantly affects young and middle-aged females ages 20 to 50. But in the U.S., it involves 5% more in women than it does men. Although it is a very touchy and debatable subject, they know that fibromyalgia does exist, and it causes a lot of poor physical and social functioning, and it is associated with a lot of depression due to the isolation, and feels like they cannot come to a healthcare professional. It is very isolating. Patients are more sensitive to various stimuli, such as gentle touch, any kind of pressure. The source of the sensory input is, for example, a nerve lesion is discernible in both animal and human models. The source of the neuropathic pain and where they get this unique sensory information isn't entirely known. Pathophysiology, the presence of various symptoms including fatigue, insomnia, cognitive impairments, depression, increases complexity of the condition. The studies show heightened sensitivity to pain, hyperplasia, allodynia, and central cortical processing and dysregulation of the central nervous system from the spinal cord level. Risk factors include non-modifiable, like the psychological disorders such as general anxiety disorder, obsessive compulsive disorder. There's also associated with other medical conditions such as IBS, migraines, cataplexy. Your age, young to middle-aged females, ages 20 to 50. Fibromyalgia has also been linked to other musculoskeletal disorders. Modifiable being cigarette smoking, alcohol intake, and increased BMI. Major signs and symptoms: patients experience general fatigue after standing or walking, severe muscular pain and soreness that doesn't resolve after a few days. A patient is experiencing sleep disturbances. The patient is experiencing increased sadness or depression. Symptoms: difficulty climbing upstairs or lifting their arms. Some people experience IBS symptoms and urinary symptoms secondary to cystitis. Men tend to complain more of localized pain that is specific to the jaw and head. Diagnostic testing. Researchers have not identified any objective tests or biomarkers of significant accuracy. Recent tests indicated predisposition for fibromyalgia. Numerous studies, however, have provide insights into the pathophysiology, gene expression profiling that may help the diagnostic process. But there are muscle biopsies, MRIs, and EMGs. Thank you.